The pandemic has taught us many things, one of which that has come really to the forefront is the stark inequalities in health that our population is facing.
Being one of the gatekeepers to the healthcare system, I have seen firsthand the impact of inequalities on the public.
I work in a very busy tertiary inner city hospital with a diverse population in terms of ethnicity and socioeconomic background.
I've seen health inequalities in the intensive care unit, especially during the COVID pandemic, specifically people who are obese, people who are from black and ethnic minority groups, people who are poorer.
I meet patients who are scared to access the healthcare service because they're scared of their immigration status, or patients who speak English as a second or a third language.
We know that 1 in 4 people in their lifetime will end up seeing their gastroenterologist. Now, this could be for a number of reasons, but a healthy gut is very much dependent on a healthy diet. Whilst we can support and advise people on what a healthy diet might constitute, but for many, often this is not affordable.
In the South Asian and Afro-Caribbean populations, which is quite prevalent in Manchester where I work, patients of those backgrounds are up to 5 times a higher risk and more likely to start dialysis than patients of white backgrounds.
We need to commit to tackle health inequalities by improving access to care. We need to make sure that our patients who are from black and ethnic minority groups are getting the same level of care as others. We need to make sure that people who live in rural populations have access to care in the same way as people in urban centres.
For far too long, these marginalised patients have been suffering due to the lack of desire to tackle inequality.
An acknowledgement and an acceptance that these issues are real, they exist, need to be addressed from all key stakeholders, including the government.
It's important that we try and address this inequality, and I think we can do so with the support from the government to promote a cross-government strategy. It's important to realise that this is beyond the Department of Health and Social Care. We need to look at the wider aspects.
We need a cross-government strategy to make sure that these health inequalities that were exacerbated by the pandemic no longer exist.
We have to do something about this. We need to act now on health inequalities.